Howie Mandel, Ty Pennington, Solange Knowles, Justin Timberlake, and Michael Phelps are television personalities, entertainers, athletes, and adults living with ADHD. According to ADD.org, approximately 4 to 6% of adults in the United States have ADHD, which is equivalent to 8 to 9 million adults. According to LDOnline.org, approximately 3 to 5% of children have ADHD, which is equivalent to 2 million children in the United States. I would like to inform you about ADHD and other disorders that coexist with it for 2 reasons. As a mother concerned about the effects that this diagnosis could have on her 3rd grade son now and into adulthood, I thought it would be appropriate to share this information with you today. Also, research has shown that adults have gone undiagnosed, with some not realizing their challenges until they have a child diagnosed with ADHD. In this speech, I will explain what a diagnosis of attention deficit hyperactivity disorder is and describe disorders that commonly coexist with it. I would like to start by explaining what ADHD is. When we hear or think of ADHD, we immediately associate the term with the inability to focus, but isn't it true for all of us at some point we have that problem? So what makes this a diagnosis for some and normal development for others? ADHD, or attention deficit hyperactivity disorder, is a neurobiological disorder described as developmentally inappropriate behavior, inattention, impulsivity, and hyperactivity. The first description of what we now know as ADHD was written by Dr. Heinrich Hoffmann in 1845. In his book of poems written about children and their characteristics, the story of Fidgety Philip depicts a little boy who has what is today defined as ADHD. ADHD is characterized by 3 primary subtypes with 9 different symptoms for 2 of the 3 types, primarily inattentive. Some symptoms are failure to give close attention to details, or making careless mistakes, easily distracted, trouble with organization, and trouble sustaining attention. 6 or more symptoms for this subtype, and fewer than 6 symptoms present for hyperactive impulsive subtype is needed in order for someone to be characterized as primarily inattentive, primarily hyperactive impulsive. Some symptoms are fidgets with hands or feet, trouble remaining seated, talks excessively, interrupts others. 6 or more symptoms for this subtype and fewer than 6 symptoms are present for the inattentive subtype is needed in order for someone to be characterized as primarily hyperactive impulsive. Combine hyperactive impulsive and inattentive. 6 or more symptoms are present for both the inattentive and the hyperactive impulsive subtypes in order for someone to be characterized as combined hyperactive impulsive and inattentive. ADHD can be diagnosed by pediatricians, sociologists, clinical social workers, psychologists, and nurse practitioners. The Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association is the guide that contains the criteria used by these professionals to make an ADHD diagnosis. The 5th edition of this guide is currently being prepared and expected to be published this May. In addition to the 6 or more symptoms being present in one of the 3 ADHD subtypes, they also have to be observed in 2 or more settings, such as at school and home. Symptoms must be present before the age of 7 and persist for a minimum of 6 months or longer. There is no exact cause of ADHD, but research has linked the diagnosis to genetics, environmental agents such as lead exposure, or cigarettes and alcohol use during pregnancy, and brain injury of the prefrontal regions of the brain. Now that we know what ADHD is, let's talk about the disorders that commonly coexist with ADHD. 1 or more learning or behavioral disorders can coexist with ADHD diagnosis. Dyslexia is a language-based learning disability and refers to a cluster of symptoms that result in trouble with specific language skills such as reading. Tourette syndrome. Only a few people with ADHD experience nervous tics and repetitive mannerisms associated with this disorder. ODD, also known as oppositional defiant disorder. 1/3 to 1/2 of children, mostly boys, have this condition present along with ADHD. It is described as being routinely defiant, stubborn, non-compliant, and argumentative with those in authority and refusal to obey. CD, or conduct disorder. This condition can occur in 25% of children, 45 to 50% of adolescents, and 20 to 25% of adults. It is associated with efforts to break rules without getting caught, and often described as delinquency. Depression. 10 to 30% of children and 47% of adults with ADHD also have depression. Environmental and genetic factors may contribute to the depression. Bipolar disorder. Up to 20% of individuals with ADHD may manifest bipolar disorder. It is categorized by mood swings between moments of high intense highs and lows. Anxiety. Up to 30% of children and 25 to 40% of adults will have this disorder along with their ADHD diagnosis. It is described as excessively worrying about a number of things, stressed out, feeling edgy, and tense. In closing, today we see that children and adults diagnosed with ADHD are battling more than just their inability to focus. By clinically defining what attention deficit hyperactivity disorder is and discussing the disorders that commonly coexist with it, I hope we all are more tolerant and less indifferent towards some child or adult who has this diagnosis.